Thank you, Mr. Chair and members of the committee. I am bringing to you today SB 447, which will streamline the complex billing and reimbursement process for California's community health clinics that dispense medication to Medi-Cal patients, and also ensure that clinics are being fairly reimbursed for the important services that they provide. So as I'm sure you know, California's community health clinics offer a unique option for low-income patients to come and receive a quality, affordable medical care. And clinics that dispense medication on site provide the added benefit of being a one-stop shop that allows patients to leave the location of their healthcare provider with both their medical care having been provided, but also medication in hand. Now, this convenience has led to improved access to healthcare and better patient health outcomes. However, unlike all other healthcare providers treating Medi-Cal patients, clinics that dispense medication are required to use a billing system that is overly complex and unfairly disadvantages and underfunds these community clinics. The overcomplicated billing system has become an acute problem recently as the clinics are seeing significantly more Medi-Cal patients due to the Affordable Care Act and the recession. This is because the clinics must do a calculation to compare the actual cost to purchase the medication plus a dispensing fee for the medicine to what is considered the, quote, usual charge to the public. That is the average cost to a non-Medi-Cal payer, such as a healthcare plan. Now, the clinic then bills the state at whichever amount is lower. So the Department of Healthcare Services then compares the billed amount to the published Medi-Cal rate and reimburses the clinic at the lower of the two amounts. The system obviously causes several problems. First, for some medications, the department has not set a dispensing fee or has set it below the legal level, confusing the amount that the clinic can bill. This has caused massive billing errors that require an inordinate amount of time and resources by both clinics and the state to resolve, denying community clinics much needed funding and certainly creating a lot of hassle. Further, since the clinics are required to bill one amount but can be reimbursed at a different amount, it's incredibly difficult for the clinics to budget accurately. Pharmacies, on the other hand, know at the point of sale how much the state will reimburse them for the medications they dispense to Medi-Cal patients. Plus, their claims are processed electronically, reducing billings errors and offering a certainty not given to affordable community clinics that are dispensing medicines. So SB 447 will simplify the billing and reimbursement system for community clinics by allowing clinics to bill and be reimbursed at the Medi-Cal rate like other folks. This simplicity will ensure clinics receive the reimbursement to which they're entitled, increase clinics' funding certainty, and enable them to better serve their patients. So here today with me, I have Charles Ferrand, who's the CFO of Planned Parenthood in Orange County, and I've also got Ben Avey, who's Associate Director for Policy and Communications with the California Primary Care Association, who are going to speak in support of the bill. I also have Beth Park with the Planned Parenthood Affiliates of California, who can also help to answer any particularly technical questions that might arise. So with that, I'd love to turn to the witnesses with the chair's permission.
Sure, welcome. Please proceed.
Thank you. Thank you very much, all of you, for your service to our communities. I'm Charles Ferrand, Vice President of Finance at Planned Parenthood, Orange, and San Bernardino counties. We have 9 health centers in Southern California. Last year, we served almost 200,000 patients, offering both primary care and reproductive health care services. 92% of our patients are low income. Their health care is covered either through Family Pact or Medi-Cal. SB 447 grew out of the experience that our affiliate, as well as the other community clinics in California, has had the past 2 years in billing and getting reimbursed for drugs and supplies under the Family Pact and Medi-Cal programs. As you can imagine, Planned Parenthood is a major provider of birth control and emergency contraceptive in California. Each year, our 115 health centers handle more than 1.6 million patient visits. We serve as a one-stop shop. We examine the patient, handle any necessary labs, and dispense most of the drugs that our patients require. This model reduces barriers to care, improves access, and increases patient health outcomes. Yet we have experienced enormous problems getting reimbursed for the drugs and supplies that we dispense. This past year, we collectively were not reimbursed more than $24.5 million for drugs that we had dispensed 1 to 2 years ago. We incurred all the expenses to dispense those drugs, paid the rent, paid our employees, handled all the ancillary expenses necessary to run a health center. In addition, because of the unduly complicated system and calculations needed for drug reimbursement, we had no way of knowing what we would get paid and when. This makes it virtually impossible to prepare budgets, estimate cash flow, and balance our books. Our affiliates have done everything to remedy this situation. We have held countless meetings with the state and its fiscal intermediary. We have hired additional personnel, both individually and collectively, to process claims. But most importantly, we believe that we need the billing and reimbursement system simplified to eliminate billing errors and reduce the time and resources it currently takes to handle those problems. SB 447 will do that. It will enable community clinics to bill and get reimbursed for drugs and supplies at the Medi-Cal rate. This will eliminate the need for our clinics to calculate the lesser of amount for each drug and supply they dispense. It will similarly eliminate the need for the state to adopt complex algorithms to calculate the lesser of what is billed in the Medi-Cal reimbursement rate. The simplification should greatly reduce the number of billing errors and processing adjustments that have deprived clinics of millions of dollars of earned reimbursements for months and sometimes years. It will also allow us to budget more accurately and close our financial books on a more timely basis, without continually having to go back and readjust our financial statements if and when we are finally reimbursed. Community clinics are strongly committed to ensuring quality health care to the low-income residents of California. We just need to be reimbursed equitably and timely for that care. SB 447 will do that. We ask sincerely for your support. Thank you.
Thank you. Anyone else in support?
Mr. Chair, members, I know you have a packed agenda, so I will try to be brief. My name is Ben Avey, and I am representing the California Primary Care Association, who represents 1,100 community clinics and health centers here in California, who serve 5.6 million of California's most vulnerable patients. We are in firm support of SB 447. Our mission of our members is very simple, which is to provide quality care to everybody that walks through our door. Many of those members are enrolled in the Medi-Cal and Family Pack programs, and we believe that this measure will take us one step closer to simplifying a very complex process for billing and reimbursement, making it more simple, providing for equitable reimbursement of our services, and reducing the administrative burden that currently goes with the program. We do ask for your aye support today.
Thank you. Support? Anyone else?
Chair and members, Kathy Mossberg, California Family Health Council, California Family Health Council in strong support of this simplification. Thank you.
Anyone else in support? Opposition? Questions, comments from any of the members?
Move the bill.
Moved by Senator Mitchell. Any comments, questions from any of the members? Seeing none, Chair is going to recommend an aye. Would you like to close, Senator?
I agree with the chair, and I very much respectfully ask for an aye vote.
Thank you very much. This is item number 10, SB 447 Ellen, due pass to appropriation. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Aye. Nguyen, aye. Hall. Mitchell. Aye. Mitchell, aye. Monning. Aye. Monning, aye. Nielsen. Nielsen, aye. Pan. Roth. Aye. Roth, aye. Wolk. Aye. Wolk, aye. 7.
Currently has 7. That's enough to get out. We're going to place that bill on call. We have some members that are absent. Thank you. I believe.
Thank you, Senator.
Thank you, Senator. Senator Wessel. Item number 7, SB 287, automated external defibrillators, AEDs. Good afternoon. How are you?
I'm doing great. Thank you, Mr. Chair. It's a pleasure to be here. I'm proud to announce today the introduction of Senate Bill 287, the Senate Cardiac Arrest Safety Act. This bill is based on some work that I was involved in as a council member in the city of San Diego. And in San Diego, we created a program that required the placement of automatic external defibrillators in buildings that had lots of people within those structures. And that bill, that law in San Diego was approved in approximately 2007, 2008. It rolled out in 2008. People started complying with that program. It has been such a successful program in assisting and helping to save lives that we thought that unrolling this program statewide would be such an important tool to help address cardiac arrest in the state. This year, an expected 350,000 individuals will suffer from a sudden cardiac arrest. 9 out of 10 of them will not survive. This work that we have started in San Diego has contributed to increasing survival rates. For those individuals that experience a cardiac arrest, their life is largely reduced. Their chances of survival are reduced because oftentimes their access to health care or assistance, the time it takes to respond to those is often too long. If it takes healthcare personnel 9 minutes to reach a patient, in many cases, brain death starts to occur 4 to 6 minutes after someone experiences cardiac arrest. So while we can get somebody to assist them, oftentimes it'll be too late. And so that's why this bill is so important. An automatic external defibrillator is such an amazing technology that has entered the marketplace, where it enables the average person with no real knowledge of how to assist a patient or a person in distress the opportunity to aid somebody in need. So this equipment provides the instructions necessary to provide a response to these individuals and allows them to contribute to saving lives. So it helps to buy the patient time while help is on its way. In many cases, the AED helps to restore that person's consciousness, or to help kickstart their heart, or to help maintain oxygen to the brain in the interim. So I'm pleased to announce this requirement in the state of California. This is a bill that already has been shown to work in one part of the state. I believe that, being familiar with California that I am, that we'll be able to implement this new law, and that we have requirements in the bill that will make it possible to implement this bill, and that this bill will be necessary to shield the businesses from the liability that they need to implement the bill, but also, more importantly, that this put the people's lives first, and that we'll be able to help people survive. So I have with me today Sean Henschel with the American Medical Response, and a few other members of our community that would like to testify in support of this bill.
Thank you very much. Please state your name.
Johan Claes, representing Paramedics Plus, who is Alameda County's 911 EMS provider. Paramedics Plus is in support of the measure. As the Senator has stated, these are devices that are becoming easier and easier to use. We have donated many of them throughout locations in Alameda County, and would even suggest that perhaps the committee support an amendment to the bill where the location of these devices in the buildings would be listed with the local 911 dispatch center and the EMS agency.
Thank you, Mr. Chair and members. Sean Henschel here on behalf of American Medical Response, California's largest provider of 911 ambulance services. We're in strong support of the bill. We commend the author on his leadership on this issue. Respectfully ask for your aye vote. With me is AMR paramedic Gabriel Cruz to show you just how user-friendly these things have become.
Good afternoon. As indicated, my name is Gabriel Cruz. I'm a paramedic with American Medical Response. I've been a paramedic for just about 13 years. I have with me a universal AED device, and I'm going to demonstrate how easy this device can actually be utilized. The very first thing you're going to want to do, obviously, is grab the device itself and grab the paddles or the fast patches. On the fast patches themselves have the pictures of indication where they need to be placed on the body. So it'll expose the patient of the clothing, place them on to the patient, and then turn on the AED, and I'm going to do so now. It's indicating to go ahead and apply the pads to the patient's bare chest. And then what I'm going to do now is insert the device to the AED itself.
Apply pad analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button now. Shock delivered. Begin CPR.
And as you can see, it clearly demonstrates step by step of what to do in an emergency situation.
Anyone else in support? Opposition?
Just have a question.
Seeing no opposition, is any questions, comments from any of the members? Senator Nguyen.
Thank you, Mr. Chairman. Senator, I'm fully supportive of this. I've been working and helping and trying to even get these AED to be donated to schools, especially high schools where a lot, when they're playing aggressive sports, they end up collapsing and et cetera. These are what saves these children's lives. So I think it's the right direction, right thing to do. But my one question is, why did we exempt government buildings? I mean, at the County of Orange, we actually have it. I know we've saved many individuals at John Wayne Airport in Orange County. We also at the Board of Supervisors on the 5th floor. I remember every time when the clerk isn't there, they would send all of us an email to tell us where the AED is for the day or whatever hours it is, where it is. I took the class, and so received a certificate for it as well. So if we believe in the policy and it's the right thing to do, it should include government buildings because, actually, I don't know if this building has them, because we have a lot of people in the audience. Anything can happen in a minute.
Well, we do have them, and this bill is very focused. Not only does it pertain to all buildings, but it specifies buildings with large amounts of people, and not even those, right? If it's a hall that has a lot of people, it's not a building that's in use constantly. So we've really defined the scope of the bill for buildings generally. We feel confident, because I'm from San Diego, and wherever I go, whether it's at the government level, that these have been successfully introduced to government buildings. They have been in San Diego, they have been at the court level, they have been the county level. So with this bill, we're trying to guide our, a lot of times we're criticized for requiring bills that won't really have an impact, right? So why do we do this if we already have that? That's what we don't want to do. That we don't want to create an unnecessary law to cover an area that doesn't necessarily do anything, because we feel that government in California has actually been pretty proactive at having AEDs in their buildings. And of course, in government buildings, they're mainly offices. We are concerned with areas that have high occupancy and high attendance. So where we have lots of people present, I think generally government has already done a good job at doing that. So we have done our research on this bill, and we have seen how this bill, at least in the pilot program that I know of in the state of California, which is San Diego, in targeting the high occupancy buildings in those commercial areas that don't necessarily put focus on this kind of preventative measure, that we do that there first. And so this will create an enormous amount of coverage. Our schools have them, our government buildings have them, and now we're going to focus on areas where they're not present.
I didn't know, I mean, do we have a data to show that all the schools and all the government buildings have them? Because I'll be honest, I'm still helping in Orange County to try to get some of these to the schools, and we're getting donated used AEDs because the schools won't provide them. Mm-hmm. So I don't think that all the schools has them. And when you're talking about large congregated or a large number of people in a building, it has to do with government.
But what schools do have in those instances, if they don't have an AD, they usually have a nurse. So
I don't-
not all of them, but
Yeah, I don't-
but I know in the schools that don't have them, we do have nurses there. So, you know, that's also a difference in those areas. Not all government buildings have nurses, not all schools have nurses, I understand, but that's why your efforts in placing ADs where they don't have health personnel is also very important.
Well, perhaps, Senator,
sorry.
maybe you can kind of address our concerns as we move it along to see if maybe you can amend it in a future hearing or,
Okay.
committee. So if you have any concerns.
Yeah, I would appreciate a consideration for schools, and why I understand that some schools do have nurses, but when you're talking about sports, you're talking about after hours. The nurses aren't there. The coaches are there, the parents are there. These are the locations that these children needs these. It's not a lot, but it's, we get to save one life at a time, and for a life we can save, it's the best thing.
And now you're talking about having them on fields, right, which is
Well,
not
not
the
on
building.
fields, not so much on fields, but access to where, even in the school grounds, there's got to be a few of them, different locations in the schools, not just in one location where they're, the main office and everywhere else is on the other side. Especially with high schools, they tend to be a lot larger. And so if you can consider government buildings and government facilities, because they do tend to have a lot of people, and not just commercial buildings.
Okay,
Thank you.
very good.
Thank you. Seeing no more comments or questions, is there a motion? We have a motion to move by Senator Wolk. I see Senator Roth has changed. He looks quite a bit different. Chair is recommending an aye. Would you like to close? Senator?
Just respectfully ask for your support today. Thank you.
This is item number 7, SB 287, due pass to Judiciary Committee. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen.
Aye.
Nguyen, aye. Hall. Mitchell. Mitchell, aye. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan. Roth. Wolk. Wolk, aye.
Currently at 6. We'll put that on call.
You thought I was a member? Came in the back door.
Item number 12, SB 614, Leno Medi-Cal Mental Health Services Peer and Family Support Specialist Certification.
Thank you, Mr. Chair and committee members. I recognize that you've had a long day and there's no opposition, so I'm going to be very brief. This bill will allow California to join 30 other states which have established a comprehensive framework to certify peer support specialists in behavioral health under our Medi-Cal program. Peers, of course, are people who have used their lived experience with recovery, coupled with training, and to support others in behavioral health settings. Often peers share not just lived experience, but neighborhood, language, and culture with those that they serve. So California currently has no standard in law or definition or standard trainings for peers. Peers are doing excellent work as we speak in every county throughout the state, and we could be obtaining a 50% federal match on their services. So this makes both fiscal and good policy sense, and also it will help improve the lives of many people who are struggling with behavioral health issues. I would ask for your aye vote.
Thank you. We have support on both sides, no opposition. Can we just please keep them brief and state your name?
Sure. Adrienne Shilton. I represent the County Behavioral Health Directors Association. We represent the public behavioral health authorities across the state. We are the proud sponsor of this legislation. We would like to commend Senator Leno for authoring this bill, which would establish, as he mentioned, a peer and family support specialist certification in the state. Counties and their nonprofit contracted providers are currently hiring peers, folks who have lived experience either through their own recovery journey or as a family member or a parent. The framework for this bill is based on federal guidance from the Center for Medicare and Medicaid Services, as well as this issue is contained in the Department of Healthcare Services waiver that they've submitted. So we ask for your aye vote.
Thank you. Please.
My name is Sally. On? Okay.
There you go.
My name is Sally Zinman, and I'm the Executive Director of the California Association of Mental Health Peer-Run Organization. It's a statewide organization consisting of consumer-run organizations and programs which themselves serve thousands of mental health consumers. Peer support is happening across the state. It's not a matter that it's beneficial. Reports have proven that it's beneficial. I've seen its benefits face to face. It's that it's happening. There are over 6,000 peer supporters across California. It's estimated to grow with the Medi-Cal expansion, and yet there is no statewide scope of practice, standardized curriculum, training standards, supervision, certification protocol. We need certification to standardize this practice and ensure providers are qualified. It's here, it's growing, it's happening, it needs standards.
Thank you.
I would like to add one other thing. For me, it's a win-win. Personally, if it's wonderful that it's being done across the state and that it is possibly, if you could get a 50% match, that it will bring in income. But for me, in and of itself, it's important because it validates peer support and it validates peer supporters. If it never brought in income, it would be wonderful for me.
Thank you very much. Name and position only.
Lucinda De Rossi, the California Association of Social Rehabilitation Agencies, which represents CBOs across the state and also represents the ethnic and cultural diversity of the state. Thank you.
Michelle Cabrera with SEIU California in support.
Thank you.
Linda Way with Western Center on Law and Poverty in support.
Maggie Merritt on behalf of the Steinberg Institute in support.
Steve Cruz on behalf of the Sacramento County Board of Supervisors in support.
Stacy Hiramoto, REMCO, the Racial and Ethnic Mental Health Disparities Coalition. We have a support if amended and have very strong concerns about this bill that we have talked to the author's office. They were very understanding of our concerns. The bill as passed, we feel, will not address the needs of racial, ethnic, and cultural underserved communities in California. We look forward to continuing to meet with the sponsors. We do not want to stop this bill, but again, we feel that as written, it will not serve our communities. Thank you.
Laurel Ben-Hamida, REMCO Steering Committee, and speaking for a large Muslim community in California, approaching 1 million people from South Asian, Afghan, Persian, Iraqi, Middle Eastern, Somali communities where they need people who have language competency, cultural brokers. So in support, if amended, along with the REMCO. Thank you.
Afternoon, Chair, members. Jim Gilmer, Racial and Ethnic Mental Health Disparities Coalition, also co-coordinator of the African American Strategic Planning Work Group of the Reducing Disparities Project, and locally Oxnard Multicultural Mental Health Coalition. Would support it if amended to include cultural idioms as expressed by my two previous speakers, including community health workers, cultural brokers, and other terms and phrases that are more congruent to racial and ethnic populations. We'd be certainly willing to work with the author. Thank you.
Margaret Johnson with Disability Rights California. We are in support.
Amber Wiley with the Association of California Healthcare Districts in support.
Donna Seitz representing Los Angeles County Board of Supervisors in support.
Farrah McDade King representing the California State Association of Counties in support.
Michael Beebe representing United Advocates for Children of California. We're a statewide organization of parent partners and we're in support.
Joe Rose, President, NAMI Alameda County South, in support.
Khalif Asaga on behalf of the National Alliance on Mental Illness California in strong support. Thank you.
Thank you. Any in opposition? Questions, comments from any of the members? Do we have a motion? Motion by Senator Wolk. Chair is recommending an aye. You have a question, comment? Item number 12, SB 614, due pass to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Mitchell, aye. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan. Roth. Wolk. Wolk, aye.
Currently at 6. We'll put that bill on call.
Thank you, Mr. Chair. Glad we could bring you all together.